disorders among doctors. Also, a study found UK female doctors to have higher suicide rates than females, than the females in the general population. Female doctors are 2 times or twice more likely to suffer from depression. I'm sure from your lectures you've had in psychiatry, you already know that depression occurs twice in females as it occurs in males. And when it comes to doctors, that twice is further doubled among female doctors. This was from a Canadian study. So why bother at all? Why do we have to bother about the mental health of doctors? We are all, you all are upcoming doctors, and what we do in school now, or how we lead our lives and comfort ourselves and go around managing our health and mental health has an impact on how or the state of our mental health once we are out of school. We are concerned about the mental health of medical students and doctors, or medical students and upcoming doctors for that matter, because quality of care provision goes down if doctors get more stressed. The same way quality of health goes down if medical students get more stressed. They're unable to learn well, they do not pass their exams, or they barely pass. And sometimes the person is at 49.8. You are tempted to push the person over. With time, we are pushing non-quality material or non-quality caliber of health professionals out there. And then doctors who have unresolved mental health issues are more likely to cause harm to others. And so we want to make sure that in our day-to-day activities, we are in good mental health. The same thing applies to medical students who have unresolved mental health issues. We go to the ward, we clerk patients, we get interactive with students, we are on the ward, chaperoning our consultants, and sometimes getting hands-on experience with caring for patients. And if there are unresolved mental health issues, in our bid to learn, we are likely to cause harm to the patient. Again, when medical students and doctors develop mental health or mental disorders, they develop what we call the pathological cynicism. They get to the level where they're unwilling to care for people who are chronically ill. They develop apathy, there is decreased empathy, and death may occur both in the life of the patient who is a medical student with unresolved problem, or the doctor with unresolved mental health problem, or the death can occur on the part of the patient. Now, when it comes to the risks for mental breakdown in the medical field, currently there is no study that has given evidence that medical schools around the world attract people who are more prone to mental illness. And so at the entry into medical school, mental health of students is no different from the mental health of the general population. Sadly, by the end of the first year, the mental state of medical students becomes significantly worse than other students. All right, so I talked about the fact that at the entry into medical school, mental health of medical students are the same, or they are no different from the general population. Or sadly, by the end of just the first year, the mental health or mental state of medical students have been found to be significantly worse than the general population. And the stress accumulates throughout the training of medical students through even into their working lives. That is not all. Healthcare practitioners work in the interface of life and death between well-being and disease, leading to emotional distancing from patients. We know that by the nature of our work, it's either your patient is doing well or it's not doing well. You are losing the patient, or you are making them well. And so that's interface between life and death, between well-being and disease state, cause us as medical professionals to emotionally distance ourselves from patients, so that we don't have to cry at every death, we don't have to cry at every worsening scenario. And yet, if you see the death of a loved one, if a loved one is not doing well, a family member is not doing well, that person is a patient as well, and yet you are supposed to exercise your normal emotions. And so compartmentalizing your emotions such that if it is about your patient who is not a relative, you don't have to cry, you don't have to be sad. But if it is about that patient who is now your mom, who is now your sister, a cousin, you should feel your normal emotions and be sad. All of these can make the health professional very stressed, and some of these emotional factors are some of the things that stress out the health professional. Again, there's a relative shortage of healthcare workers in many countries, especially in sub-Saharan Africa, where Ghana is located. You and I are located. Many of you are already making plans to leave the country as soon as you finish medical school. You are helping the doctor-patient ratio in other countries and widening the patient-doctor ratio in your own homeland country. And the rest of us who remain here keep getting stressed because of the shortage. There's also long hours of strenuous work, which predispose the health worker or the doctor to depression and other mental disorders. And most of the time, the health professional neglects their own health. In many instances, they are not well, they are dealing with some migraine, some dysmenorrhea, some cold or catarrh, and yet they have forgotten about all of that, and they are at work taking care of other patients. We realize that notion that the doctor should not get sick or should be strong, should put up a strong face all the time, some way, somehow cause the health professional to neglect their own health in many instances. There are other causes or the risks of mental breakdown in physicians, like the personal trait of perfectionism that has also been identified in some detailed studies. Again, the perfectionism, please, next slide. That perfectionism leads to thoroughness, but it's also believed to make it difficult for the doctor to forgive themselves if they make a mistake. If you know that the chlorpromazine that you administered to that patient should have been IM and you gave it IV, and the patient went into sudden hypotension and died, nobody might have known the mistake was from you, but the guilt can overwhelm you, because in the health sector, a mistake can actually cost a life. In other sectors, if a lawyer makes a mistake, someone is losing a case. At work, someone is going to jail. If a businessman makes a mistake, they lose some money. But if the doctor makes a mistake, they lose the most important thing in this world, which is life. And that makes it very difficult for the doctor to forgive him or herself when mistakes are made. Again, the same perfectionism leads to some competitiveness ingrained even in medical training. Nobody wants to trail. Things are tough. You want to chill. You are stressed. You will soon finish, and you don't want to even do a receipt to be added to the next batch of doctors that will graduate. Because people may feel that, oh, this doctor, because did not graduate with his colleagues, is not a good doctor, and you are afraid of what the society will even see or say about you. So there's a lot of competition when it comes to the medical training. And there are some specific complications that are peculiar to Ghana for us. the poor working environment, inadequate recreational activity for the medical student. You are at your hostel. I'm not sure whether there's a swimming pool in any medical student's hostel anyway. Considering the stress that medical students go through, I think that special recreational activities should have been made or provided for them, just for them, even if it cannot be done for the entire university students. Swimming pool, basketball, volleyball, stuff like that, football pitch or football park, things that will let people rest from time to time so that we don't end up getting stressed. Yes, I saw the thumbs up. And then sometimes the disciplinary actions, and that is why one of the reasons why we have to do this lecture, when people, medical students, and even doctors find themselves involved in some mental disorders, people think that they should be punished for it. For instance, if a medical student is addicted to alcohol, we most of the time forget that addiction to alcohol, or alcohol dependence, is a mental disorder, is an illness, and we are tempted to see or to judge this person from a moral point of view, that is a spoiled child. This is we have advised them, this person is drinking too much and they won't stop despite all the advice and caution and all that. Meanwhile, if another student, another colleague is suffering from an asthma, they get an asthmatic attack, everybody is willing to help. They are rushing the person to the emergency and all that. And we forget that asthma is a medical condition as much as alcohol addiction is a mental condition, a mental disorder as well. And so all of these make it difficult for the medical student or the doctor eventually. Burnout becomes an inevitable consequence of some of these things and can predispose trainees and even doctors to mental disorders. So what exactly must be done? What can we do? I have always promoted that prevention is better than cure. I'll talk about the prevention, and I'll end on, if prevention does not work and the person breaks down, what can we do? So there is a 2007 medical students health survey that was conducted by E. Frank et al. It was done in conjunction with Canadian Medical Association, and so far is the largest and most comprehensive study that has been done to date concerning the issues of mental health and health in general of medical students and then health professionals. This study brought to light several aspects of health that warrant further attention. The study brought to light the fact that simple things like paying more attention to nutrition, paying more attention to exercise, having good sleep, and self-care are issues that affect the medical students on a daily basis, and they should be given attention to. Not every student or not every medical student will have to or is going through or dealing with substance abuse or is dealing with depression, but largely everyone or most people are facing the challenge of incorporating these healthy preventing habits into their busy lives. Are we eating well? Are we sleeping well? So now there's an increased focus on healthy living among the medical students that could help prevent the progression of stress and burnout into serious health issues, including mental health problems and addiction. What are some of these healthy lifestyle or healthy habits that we can incorporate? They identified about 4 or 5 major ones, and we'll quickly go through it. The first is exercise. And sometimes we think that we have so much to read, we have so much to clerk, we have so much presentations to do, or we have some sleep to catch up, that we forget to even think about exercising. But hey, exercising at least 3 to 4 times a week has been found to be very helpful. One of the ways we can prevent mental breakdown. And it is not just any exercise. It's just because you walk from the hostel to the ward, or you walk up and down the stairs chasing a sample for a patient you are following up is enough an exercise. No, this exercise that can can lead to distressing is that which is done to the point of perspiration, and it's advisable that you do it 3 to 4 times a week. The Public Health Agency of Canada guidelines specify a minimum of 150 minutes of moderate to vigorous physical activities per week for adults who are aged between 18 to 65. And so we will have to make a conscious effort to incorporate exercises into our routine. 3 to 4 times a week, 30 minutes at a time should be fine. And you should do it to the point of perspiration. That is when you break through your stress levels. Exercising is not the only thing. In addition, nutrition is very helpful. It's advisable to eat at least 2 hot balanced meals a day. Next slide, please. Some of us will consistently eat maybe roasted yam, or it is gobe, because for students gobe may be what is affordable. You take a lot of gari, few ripe plantain, so that the gari will rise in your tummy and you'll be filled the whole day. Make sure that your food you are eating is well balanced and it is hot. And when we say well balanced meals, we are looking at diets that are high in fruits, vegetables, and unprocessed whole foods. You may be wondering, how can we use our small pocket money to go and buy vegetables? We are looking for things that will fail us and save us our money, but you'll be doing yourself a lot of great service if you don't incorporate some of these healthy eating lifestyles into routine. Nutrition, make sure that you stay hydrated with plenty of water. I would advise that you get small water bottles into your lab coat pockets that you can sip on whilst you are working on the wards, whilst you are moving in the course of the day. That is very, very helpful. And then it's been found out that if the effect of nutritional intervention show that there is an association between nutrition and cognition. And so if you are eating well, your cognitive functions tend to improve. Okay, your ability to recollect, your ability to absorb when you are learning. If you are learning on an empty stomach, you are deceiving yourself. You are unable to retain many of the things of the things you are learning. The most cited emotional symptoms that has been linked to poor nutrition is irritability, frustration, difficulty in concentrating, and poor or slow decision making. And so if you are not eating well, you are hungry, you have not incorporated vegetables, fruits into your meals, and then what happens is that you are always on the edge. You easily get angry. Your roommate is just joking about something and you take it personal. You are frequently angry and all that. Check your diet and make sure that you are eating well. That may be the cause of your frequent flare-ups. Again, students should have access to healthy food, and students' restrooms should be made available on the wards with refrigerators to support food storage, and even microwaves for warming their food. So if you go to the clinical area, you don't think that you may get any healthy food, you can prepare something, put it in a lunch box, carry it in your bag, your backpack, or carry it with you to the ward. And then we are advocating that the hospitals should specifically have restrooms for students, and these restrooms should have refrigerators. They can store their food whilst they move around on the ward, and then when they come back and they are ready to eat, they can also warm it. And these are some of the things that Medical Students Association can take up with the hospital management or with the schools leadership to provide some of these things for you so that you can eat healthy. And then the third thing to do is sufficient rest. Get plenty of sleep and be consistent with your sleep schedule. Nobody has been successful studying all night every day. Sometimes we think that mining the whole night and sipping on coffee or chewing gum or way back in the secondary school, I don't know whether people still do it, putting their legs in water, buckets of water and all that, is what will let you produce or give out all their poor or give out your filler during the exams. No. Having sleep and making sure that your sleep time is consistent is very, very important. Now, the studies have shown that the sleep that is enough to put away stress is having 7 hours of sleep at least 4 days in the week. And this has been made easy. In Kumasi, we will say that this is a 2-4 ball. Earlier studies had said that adults should sleep 8 hours every day to be able to put away stress. But with recent studies, things have been better, that even if you get 7 hours of sleep 4 days in the week, you are good to go. The remaining 3 days, you can choose not to sleep. But as for 4 days, at least a minimum of 4 days, make sure that at all costs, you are getting 7 hours of sleep. If you can afford, take a few short breaks throughout the day and allow your mind to rest periodically. Don't keep your mind always consistently on the go. For about just 5 minutes, you can decide to switch off everything. Don't think about anything. Just let your mind go blank and let the mind take a rest. And that has been found to be very helpful. The sufficient rest we are talking about here include taking a break from your normal routines and pampering yourselves once in a while. Most of us want to wait till it's our birthday, it's Valentine, it's Christmas, and now the thing people do is my birthday, who is taking me out, who is available to hang out with me. Please chill on your own. Plan and take your own personal chilling very personal, because it will contribute to your personal mental health promotion. And so don't wait till it's your birthday. Just out of the blue, you can decide on an ordinary day that I'm not taking the usual Hausa cocoa or the Milo I take in my room all the time, but I've saved up some 200 or 250. I'm doing a buffet breakfast at Alisa Hotel or at any restaurant around. And you realize that as you do that, nobody might have seen you, but there is an inner fulfillment and joy that comes into your life to improve in general your mental health. And sometimes you want to even travel out of town on some weekend, gather a few friends and go and chill and come back. But the caution here is that chill within your budget, okay? Don't go and chill and run out of your pocket money, and don't go and chill when you have not planned your program or your semester well to be able to learn enough. And that is why, if you will be able to rest sufficiently, there should be a well-planned schedule for your term or for your semester, such that you are learning right after every lecture. Right after every lecture, you are reading over your notes. If you do that close to exams, you will not have a pile up of notes to do, and then you will be able to chip in these rest and chilling from time to time. And then the fifth thing to prevent mental breakdown is to get support from colleagues, what we call the buddy system. Develop the buddy system. Identify one person that you call a buddy, and the buddy we are referring here is a colleague who has accepted to be of support to you. So you check my back, or you watch my back, I watch your back. You monitor each other's stress levels and workload. You say that, Charlie, nowadays, I see you are studying all night, or the person may even be your roommate. Nowadays, Charlie, every time I wake up to the washroom, you are up on your phone, you are not sleeping. Is there a problem? I think this is not good for your health or for your mental health. Let someone monitor you and give the person the right or your permission that they can monitor your stress levels for you, to keep an eye on you and feel safe to talk about it. Sometimes if the person has not given you the permission and you go and talk about what you have observed, they may get angry. But this time in the buddy system, you give the person the permission that, Charlie, when you see things are not fine with me, talk about it. If you see that nowadays, the way I'm talking too much, or I have become reserved, or my behavior, I come to lectures, I don't even comb my hair. I come and I have laced one shoe, I did not lace the other. I've ironed one part of my shirt, I did not iron the other half of the lab coat. Look, I give you permission to tell me, to draw my attention, so that I put things quickly back in check. And then it's important also to get support as part of the buddy system, to get support from each other. In the buddy system, you can decide to take breaks together. This time around, if you don't want to go out in the evening, go alone, go out with your buddy, take some healthy drinks. Don't go and binge on alcohol. Take healthy drinks, get some fresh air outside the hostel, outside of the hospital, and come back. Now, long-term preventive measures involves raising awareness of mental illness among students through regular mental health education. So again, I would put this responsibility on the student leadership, year leadership, and all that. From time to time, just run seminars on mental health. What we are doing here today is very good, but October, is widely celebrated, and a lot of mental health awareness is created during October. But in addition to that, maybe once every month or once every quarter, students can have seminars, invite your lecturers, your psychologists, clinical psychologists. You have a lot of professionals at the psychiatry unit just to give a talk on some mental health topic. And then mental health first aid training for all students. These are readily available online. You can take the training on your own. This is similar to first aid, what we call the first aid box. If someone has a first aid box, inside the first aid box is probably spirit, cotton wool, plaster, something when someone immediately gets injured, they can do. The same thing applies to this kind of first aid, mental first aid, mental health first aid training. This helps students to be able to immediately apply some support or render some psychosocial support whenever they see their colleague breaking down. And then I propose that there should be emergency lines for students to call in at all times when they are distressed. These should be toll-free lines. Every medical school should have a toll-free line. Fortunately, the Mental Health Authority has a toll-free line for suicide. If you are feeling suicidal, you are feeling stressed, you can call these numbers 24/7. But beyond what the Mental Health Authority has put in place, I believe that in our medical schools, we should also do that. And most importantly, we should all support in reducing stigma by normalizing talking about mental health, normalizing disclosing personal mental health challenges. If we keep stigmatizing against people who open up, or people we know have a mental disorder or have a diagnosis, then many more people will keep quiet about what they are going through, and it will be at our disadvantage. So let's normalize seeking help for mental health struggles. Down in Kumasi here where I work, my medical students are very open about their mental health status. In fact, now I am even getting overflow of them in my consulting room. They walk in. I mean, you don't have to refer them, you don't have to push them, you don't have to force them. The students walk in voluntarily. I'm not sleeping well, I feel depressed, I feel anxious, I need help. And they are queuing every day. And I think that it's been helpful because we're able to catch their symptoms early and give them support. Mind you, the statistics show that health professionals are at risk. So whether you like it or not, the professional, the training come with some risk. So don't be shy about getting help. If it's about your roommate, escort the person. They do it very beautifully here. Someone is coming and they are coming with their roommates, they are coming with their group mates. It's so beautiful. It shows the support they have, and the fact that you send a message across to that person struggling that it's okay, we are here for you, we have your back, and we'll help you get the support that you need. So if prevention fails, what do? Signs and symptoms of mental ill health show up. And what can we do? Please, next slide. What can we do when we see somebody going through any of these challenges? Next slide, please. So signs and scope of mental illness in medical students. The scope of mental illness should not be restricted to only psychotic disorders or substance misuse disorders or those we deem as severe. But the ones that are actually very common are the anxiety disorders, the mood disorders like depression, or even simple ones like dysthymia. They are very, very common. sometimes it may not be yet a diagnosable disorder, but things like decreased work output or productivity should quickly be picked and given some attention. Change in routines. If your colleague is all of a sudden consistently late to class, or they are staying so long on the ward, now they return to the hostel 10 p.m., 9 p.m. Hey, what is happening? If they experience sleep changes, temperamental changes, if they suddenly start using excessive perfume, that is one of the first signs to pick, typically among those who may be using substances. We should pick up these signs and symptoms as early or red flags of mental breakdown. Now, what do you do when people break down? Please, next slide. Next slide, please. Can I have the next slide, please? Yeah, so the Psychiatric Association of Ghana drafted a protocol for dealing with students and doctors with mental illnesses. We had an algorithm, but the font sizes are very small, so I'll elaborate on them here. So there has been an increased call for a step-by-step approach to what must be done, and these steps require a high level of confidentiality for it to be effective. The first step is that engage the student directly, engage your colleague directly, and this engagement should be in a non-judgmental way. And conversation can be started by pointing out the changes that you have observed. Kwesi, now I have realized that you are consistently reporting late for lectures. That is unusual of you, and I'm concerned. That can be one example of how to start a conversation. It is recommended that this encounter is done in a private setting. Don't approach the person in the midst of everybody and start pointing out their shortfalls. They will feel stigmatized, they will feel judged, and may not take it well. If one is not comfortable approaching the said colleague, one can approach a friend of the colleague in question. So sometimes there's a distant friend, it's a classmate, but it's not directly your friend, and you think that approaching them with your observation might be difficult. Tell their friend and ensure that their friend takes care of approaching them. What do you do? Step 2. The next line of action will be based on whether that colleague admits to the concerns you have raised or he does not admit. Now, if there is insight, what that means is that if they admit there is a problem, please, next slide. If they admit that there is a problem, then it means that they have insight. At that point, it's advisable to persuade them to seek help. That is when you can tell them, well, let's go and see Dr. Delafiabe. Let's go and see this psychiatrist at the psychiatric unit. Let's go and talk to this psychologist. And then you support them by linking them to a psychiatrist or to a mental health professional. Accompany the colleague if it is possible, and take permission on their behalf that they have missed lectures, they have missed ward rounds. Ask for permission for them. But the B part of the step 2 is if they have no insight. It means that this colleague does not admit to the changes you are pointing out to them. They are refusing the help you are offering them. At that point, please, next slide. At that point, then you activate the protocol for lack of insight. Now, for the colleague who resists or rejects the help, an informal complaint should be made by the colleague, the concerned colleague, whom we name the whistleblower, to the immediate head or supervisor, like the hostel master or the dean of students. There may be the need to contact close family of the colleague in question, and that may have some ethical considerations. Sometimes they don't want you to tell their immediate family, but if they are on campus or in their school, the hostel master, the dean of students, the pro VC, or any oh, I am I back? I went out.
Yes, please.
You can inform any superior in charge of students' welfare about what you have observed. Now, when you have informed the supervisor or the colleague about the colleague, then the supervisor can now call the student in question. And it's important that that superior does not disclose who came to report, especially so that the patient or the colleague who is suffering from mental health conditions does not feel that there's been talking behind their back. Okay. If at this point the colleague having gotten to a superior is still unwilling to get help, then you activate the what we call compulsion for treatment or involuntary treatment. This involuntary treatment is stipulated in the Mental Health Act 846. It is whereby you get a court order to admit the patient for inpatient care under compulsion for a period not exceeding 1 month, and then it's subject to review. After the 1 month, if you think that the person is not well and it must be extended, all the psychiatrists are very familiar with this act of involuntary treatment, and then they can activate it and take the student or your colleague through it. And mind you, all interventions must be documented. Caution is that we should not use any punitive measure at any step of this protocol. That the person refused to get help, so we are punishing him. That the person refused to get support, so we are punishing him. What if the one who is suffering is a senior colleague? What do you do? Maybe it's a junior colleague who has observed fourth year, who has observed the final 6th year medical student going through problems. Still go through the approach I have described. You may then involve someone above the final year student, maybe head of medicine, head of psychiatry, somebody above the person to help. Factors that would facilitate the smooth running of this protocol is that there must be, we must ensure that structures are in place, that once the student is taken to the psychiatry unit, for instance, preparing a folder, going on admission, who will pay the bills, all those structures should be in place. Medical schools should have active counseling units. In Kumasi, we have very active counseling center. I'm part of the KNUST counseling board, and the counseling unit has very vibrant counselors. Each school is attached a counselor. Each hostel is attached a counselor, and the medical students hostel is attached a counselor who has an office and consistently is available to support a patient. And that should not be all. When this colleague who, for instance, went through involuntary treatment or voluntary treatment gets well, there must be systems in place to reintegrate the person back to school. Maybe they lost a whole year out of school. That person should quickly be brought back to school, restart their education so that their medical training is not unnecessarily curtailed. In summary, medical students have traditionally neglected their own health in favor of making their academic obligations. Attitudes have shifted, however, and increasing attention is being paid to medical students' health and the physicians' health. Self-care is now considered a core competency by even some colleges of physicians and surgeons in developed countries, as physicians are expected to demonstrate a commitment to their own health and helps to promote sustainable practice. Medical associations are beginning to recognize the demands of the profession and the potential mental health risk involved, and several have created programs to address the mental health care needs of their members. And I put that challenge on you all to put together programs that will address your stress levels, that will address mental health challenges. Furthermore, we are recognizing that the mental health of physicians directly impact on the health of the larger population, and it starts from when you are in school to make sure that you are in good mental health even before you come. In conclusion, we need to dispel the myth of the never ill physician or the never ill medical student who place the need of other patients before their own at the detriment of their own health. I am so many slides ahead of you. Please move the slide. The culture of medicine must shift away from its highly competitive, individualistic emphasis on excessive workload and extreme self-sacrifice, and embrace challenges that promote optimum physician mental wellness, optimum medical students wellness, and an avenue to improve patient care. Until such a shift occurs, improving physicians' health and improving the medical students' health and mental health for that matter will be an uphill battle. So my last slide says that your mental health is your responsibility, and it should be your number one responsibility. Don't wait for somebody to take care of your mental health. It is primarily your responsibility. Thank you very much for your attention, and I have some references if you want to read some more. Thank you.